All right. Good morning, everybody, and welcome to I think this is episode number 4. We're here with 5th District Supervisor Steve Madrone. Steve, you want to say hi?
Good morning, everybody. And as you can see, I'm all masked up. Now, I'm not out in public, but I just wanted to show you some of the masking options. You can do a simple bandana, fold it into a triangle, and there it goes right up over your face. Or you can get fancier and have another mask that ties onto your ears and works out really well. And, you know, there are people all over the community that are making these masks now. So if you got a sewing machine, jump in, make it happen. Masking up when you go out in public is a really, really good idea and another way to help slow the spread of the virus. So good morning, everybody. Hi, Steve Madrone.
All right, good. Thank you for demonstrating that. I think it's, I've heard Dr. Frankovich and others stress the point, between face coverings and masks. We want to make sure that we're saving the N95 masks and the surgical masks for healthcare professionals and first responders, but for members of the general public, a simple cloth mask, just like you showed, is effective at slowing the spread, right?
Absolutely, absolutely. And I hope everybody enjoys the beautiful outdoor scenery here behind us, the beautiful budding cherry blossoms. And as we all know, spring is definitely that feeling of renewal for us, when the light starts getting longer, the days are longer. And so I thought I'd have this beautiful spring blossoms behind me to remind us that spring is eternal and we will get through this together. And I just want to thank everybody for all your incredible hard work and staying in place, sheltering at home, and practicing distancing, physical distancing from each other. So way to go. We're starting to flatten the curve, but don't let up now. Hang in there. We got a long way to go still, but you're doing great out there, community.
So one other kind of feature that has been kind of popular for these episodes has been sheltering with the Supes with soup. And so Supervisor Wilson shared his soup, and Supervisor Bass shared her stew last week. And I understand you also have a soup at home.
I do. We've got the beautiful handmade, homegrown beet soup here from our own garden. My sweetheart put this together for us, and this is a wonderful time to be thinking about gardening, being spring, and it's a great way to spend that extra time you have with your kids or whoever you're sheltering at home with. But this is a lovely bottle of homemade beet soup here in the garden.
Nice, very nice, homemade, straight out of your garden. Okay, so one of the reason that we're doing these is to get more updates from the board, to kind of talk about some common community concerns, and hear directly from you guys about what we should be doing at this point and any kind of important messages that you guys want to get across. So we'll go ahead and get into it. Maybe we'll get to 3 or 4 different points. The first question is, looking at last week and over the weekend, we've seen we've seen test results come out that show fewer and fewer positives in Humboldt County. So you touched on it a little bit already. Does this mean we're in the clear?
It does. Negatives are a positive. So it's a new math, right? And the more negative results we get, the more positive situation becomes. And the fact that the curve is flattening out a bit is great, but we really need to see a trend over a little bit longer period of time to make sure that we're back out of this situation. And so it is not the time to let off. This is the time to stay really firm on our sheltering in place and our physical distancing from each other, and practicing extreme hygiene, washing your hands 12 times a day, saying happy birthday twice, the whole thing, so that you've gotten the wrist and the in between the fingers and the thumbs, and you're doing it all. And that's another positive. I mean, we probably all needed to be doing better on hygiene anyway. And so after this is all over, there'll probably be some new changes in our culture in terms of how we all behave with better hygiene and other kinds of things. But yeah, this is the time to double down on everything we've been doing. And in another few weeks, if this trend continues and it starts curving down, we might be able to start changing some of the things we're doing. But now is not the time to let up. So hang in there, folks. You're doing great. Keep at it.
Yeah, I understand from Dr. Frankovich and reading the New York Times last week, Humboldt County was the first rural county to report a positive COVID case. And, Dr. Frankovich has talked about how other rural counties throughout the country, their hospitals and their healthcare systems are being swamped right now because of this. And so, any kind of us letting off the gas, can easily kind of overload our healthcare system. So I think it's a great point about continuing our practices and doubling down on them. Speaking of healthcare, before we get to healthcare professionals, what about the cannabis industry? Do you have any advice for the cannabis cultivators and the cannabis industry right now?
Yeah, well, what we're recommending is that folks try to hire local as much as possible. The traveling around, that's one of the big problems. If people come from out of the area, from other places, that's definitely an easy way to spread things. If somebody is coming from out of the area, they need to quarantine themselves for 14 days, and they need to take that personal responsibility to do that. And it's not just to keep them safe, but it's to keep the whole community safe. So if you quarantine for 14 days, you don't get fever, you don't have a problem, then we know that you're probably not contagious. And at any rate, so that's one way, but primarily hire local. There are a lot of people locally that need work. And so do everything you can to hire locally, set up your facilities with good hygiene, good cleaning stations, make sure that people have good distances between themselves, and figure out ways to try and help protect each other from spreading this any further. The industry is important. All jobs are important, but let's just use extreme caution in the way we proceed.
Yeah, cannabis has been classified in our local orders as an essential business. And so, there's, like you said, there's a lot of people who are out of work right now. And it's important that we hire local, because if we bring travelers in, those people need to quarantine for 14 days, and we shouldn't be traveling right now beyond Humboldt County borders anyways. So the last question.
That's right. On that last one, I'll just say one more thing, and that
Sure.
is, in the cannabis culture, it's not unusual for people to sit around in circles, passing doobies, passing pipes, and sharing in the experience. We really need to not be doing that. People need to keep themselves physically separated, not be sharing things, right? So
Yeah.
keep it to yourself. Be safe. All right.
All right. So we started to touch on it a little bit about healthcare professionals and doing what we can to make sure that the healthcare system doesn't get overrun locally. What about personal protective equipment for healthcare professionals and first responders? Are they getting equipment in Humboldt County right now?
Well, my understanding is that is improving. It certainly has been a huge issue, but there still is a shortage. And, the governor of the state has been working hard to acquire a whole lot more, as well as the sheriff and the health officer. I believe that has been improving, but we still need to make sure that these masks, the N95s, all stay for the healthcare professionals as much as possible, and for those that are really working on the front lines. For the rest of us in the community, wearing a simple face covering, a bandana, or a simple mask that can be made that can go over your ears, those are great options for the community as a whole. And, we really should not be going out for anything, but if you have an essential need that you have to go out for, please wear a mask. Going to the store, going to the gas station, bring gloves, bring the wipes so that you can disinfect things. But the mask can be made in many, many varieties, but let's save the professional ones for those that are on the front lines in the healthcare aspects of things.
Yeah, the last update that I saw come out of our Office of Emergency Services, they do resource requests. So they've been partnering with a lot of community agencies in the response to COVID, and one of the resource requests were for personal protective equipment. And it's my understanding that about 35,000 pieces of personal protective equipment have been have been delivered to local healthcare facilities and first responders. There's regular shipments of those things going out too. So a lot of people working together in our Office of Emergency Services with community partners, healthcare, first responders. It's really a great thing to see right now. Do you want to say anything about, you know, kind of the response that you've seen to this whole pandemic and kind of the community response?
Well, I think it's impressive the way Humboldt has responded. You know, the majority of the people in our community have been honoring the shelter in place and restricting their movements. That's been really good to see. I think there are still some that think this is a hoax or it's not real or it's not serious. And you really need to be paying attention because this is probably the most serious thing we've seen in our lifetimes here on the planet Earth. And, you know, the more people who take it serious and engage in social distancing, or what I like to call physical distancing, because we still need to maintain our social connections, and we can do that in lots of different ways. But it is a very serious matter. And I'm very proud of the people of Humboldt for how they've been behaving. There certainly are some issues out there. You know, we're all getting a little bit of cabin fever and stir crazy at home. So it's important to get out and to exercise and get out into nature. I think Supervisor Wilson pointed out that there's trails in every community. They're called sidewalks. Certainly try to avoid you know, each other and distance as you're navigating the sidewalks. But there are some problems with people concentrating on a few areas like Scenic Drive in Trinidad. I know, you know, everybody's got all this time on their hands. The weather's been magnificent. The waves are gorgeous when it's low tide, but people are flocking to Scenic Drive in numbers that make it impossible to do physical distancing. And in fact, when you're out on the water with all the snorting and sneezing and everything else going on as a surfer, that stuff is volatile. It gets into the air column, and 6 feet is not good enough. So, you know, the sheriff has warned people if they continue to flock to certain locations, then they're going to have to close those locations off because we need to be physically distancing ourselves from each other. So take some time and think about other places you might be able to go to where you know, can distance yourself. And when you pull up to that parking lot, if it's already full, move on, find another location. This is a big county. There's lots of places along the rivers and other areas to be able to spread out and to enjoy the outdoors, but not be so close to each other. But keep on the great work, folks.
Yeah, I saw that update come out. I think it was on Friday from the sheriff talking about Scenic Drive and how so many people are closing in together, you know, and I've seen in other areas where they've, you know, they've fully closed off beaches, you know, Sonoma County, you can't even go to the beautiful beaches out there because people just can't, people are not practicing the physical distancing. So thank you for that reminder. Thank you for all your points this morning. It's good to see you, Supervisor Madrone. I'm glad you're doing well. Looks like a beautiful morning up where you are, and I hope you enjoy your beet soup, all right?
All right. Thank you very much. Take care, everybody.
All right, stay safe.